welcome to my channel. I figure with everything going on today with the whole pandemic issue that it would be a good time to make a video going over how infections spread from person to person. So in today's video I'm going to talk about how they spread based on the precautions that healthcare workers follow in facilities, which is based on OSHA guidelines. And if you don't know what OSHA stands for, it stands for Occupational Safety and Health Administration. We just call it OSHA for short. As you can see, I did not memorize what it was called for the long name. We'll break this down by standard precautions, contact, droplet, and airborne precautions. Each type, I'm going to go over some of the infections that match each type, so you guys have some examples. And I will also go over how healthcare workers disinfect surfaces and themselves when dealing with these sorts of illnesses and infections. What we're going to talk about is standard precautions. Those are the precautions that I'm sure most people are familiar with. If you end up getting a little cut or a scrape, or if you have pets like I do and you have to clean up after them and maybe get some of their nastiness on your hands, you know, if you're changing a baby's diaper, you would go and wash your hands with soap and water. You also could use hand sanitizer, obviously, but if your hands are soiled with nastiness, you're probably going to want to wash your hands with soap and water. That all falls into just basic standard precautions. So the next one is contact precautions. If you've ever been in a hospital or if you've been in a clinic and you have seen healthcare workers put on the whole gown and gloves before going into a room, that is contact precautions. What makes contact precautions different from standard is that you're trying to keep the germs from getting on your clothes, so you don't go into the next person's room with nastiness on your clothes or your arms and be like, hey, how you doing? Infection that requires contact precautions are usually different types of diarrhea. If you guys are familiar with Colostrum difficile or C. diff, that's a nasty little diarrhea bug that is just not fun to have, or if you've ever taken care of someone with it, not fun to deal with. It can be messy. So to protect your clothes and yourself, a lot of times healthcare workers will wear gown and gloves. Now, do you have to wear them at home? No. The purpose of this video is to kind of go over that it's a different category and you would disinfect and clean differently. Now, Colostrum difficile or C. diff is a little different in that hand sanitizer does not kill that bacteria. You have to wash your hands, soap and water, old-fashioned way. And when it comes to surfaces in the healthcare setting, we wipe them down with bleach. We don't use just any regular old disinfectant wipes. It has to have bleach. Bacteria that are resistant to antibiotics is another infection that would also fall into this category, just because if you get it, it's very hard to treat it because it's mutating and adapting to the antibiotics that we have. So those kinds of things, such as MRSA, which is an infection that is resistant to methicillin, would be an example of that. Droplet precautions. Those are the ones that many people are familiar with flu season, where you put on a mask to protect yourself from droplets. That is a infection that spreads through the droplets, usually from your mouth, whether you cough, sneeze, or if you're just talking and you accidentally like spew some spit. You know it's happened to somebody somewhere. So the two common examples of infections that spread via droplets is going to be the flu. We are all familiar with flu season, and also the novel COVID-19 virus. Those spread through the droplets from people when they talk, spit, breathe, cough, sneeze, all that fun stuff. So a caveat with droplet precautions. I wanted to mention how far droplets can travel. So if you're just talking with a person like how I'm talking to you right now, just a normal conversation, the droplets can go as far as 6 feet. That is the reason why, if you've been hearing, stay 6 feet away from people for, I'm going to call it physical distancing. That is why. Because when you're talking, those droplets that you might accidentally spew out and not realize it can go 6 feet into someone else's face or their clothes. However, if you sneeze or cough, those droplets can go as far as 27 feet. So that is a pretty nice distance, and the mask keeps those droplets from getting to you or from getting to another person. That is why anytime someone is suspected to have the flu, or someone is suspected to have coronavirus, or even sometimes if a patient or somebody is just coughing like nonstop, like they just cannot stop coughing. Sometimes workers will also wear a mask to protect themselves that way. But you're also protecting other people from you, as well as you protecting yourself from other people. It's a mutual protection when you wear a mask, which is why it is very helpful during flu season if you're able to, or if you're going in a public place with this pandemic, if you're able to wear a mask to protect yourself as well as other people, so you don't bring any nasty friends home and you don't give it to someone else to bring nasty things home to their loved ones. A lot of us live with people who are high risk for getting sick in general, whether the person's elderly, whether their immune system is malfunctioning, like an autoimmune condition, whether the medications they have to take brings down their immune system, whether they have breathing issues already, really bad allergies already. It's very nice and respectful to be able to, if you're able to protect yourself and protect other people from getting sick, that we do that. We're all struggling right now, so we all got to help each other get through this together. Disinfect with droplet precautions with yourself. It's the same as the others. Wash those hands. Wash those hands. If you need to disinfect a surface, a lot of healthcare workers, again, they wipe down the surfaces with bleach to kill off those germs and those viruses and bacteria. Now, I also want to throw out there, it's hard to get bleach right now. If you're able to get any sort of disinfectant, it's still better than nothing. I'm just sharing how in the healthcare setting things are wiped down according to OSHA protocol. And the last but not least category we have of how diseases can spread from person to person is airborne precautions. Now, how's airborne different from droplet? Droplet, the virus or bacteria is literally in the droplets that spew out from spitting, sneezing, coughing, talking. And that's it. Wherever that droplet goes, that's where the virus goes. And this goes in general also with contact. Whatever body fluids have that virus or bacteria, that's where it is. So if someone sneezes with their hand, covers their mouth with their hand, touches a doorknob, and then the next person touches the doorknob, and then they touch their clothes, and then they touch their face, it's really easy to spread some of these infections. What makes airborne the most contagious category of them all is that the virus or bacteria, most of the time it's a virus, is floating in the air. You get it just by breathing in the air that has it. Two examples of this is tuberculosis, and COVID-19. So this brings me to my next caveat, and then we're going to go back to the airborne precautions. Some infections can spread to people in more than one way. Healthcare setting, what that looks like is we will execute more than one precaution. So if you've ever walked by, maybe paid attention and noticed, you'll see some signs that'll say contact precautions, and then you'll see a sign that says droplet precautions. That is because you have to do contact precautions and droplet. So in that situation, the healthcare person will put on a gown, they put on gloves, and then they put on a mask. The mask for the droplet protection, the gown and gloves for the contact protection. And we would still use standard precautions and wash our hands with soap and water real nicely and wipe things down. So the reason why COVID-19 fits in both categories is because it spreads via the droplets from people's mouths, but it also can float around in the air for people to breathe in. It can stay in the air for up to 3 days. It can stay on metal for up to 3 days. It can stay on paper for up to 3 hours. That's why it's so contagious. So with airborne precautions, a regular mask is better than no mask at all as far as protecting yourself from other people and protecting other people from you. What makes airborne a little bit different is that you have to breathe in the air, so a regular mask doesn't filter 100% of the air that you're breathing in. It can filter some of it, definitely, a good chunk, but the purpose of those regular masks that you may see like a surgeon wear, for example, or if you've been in the hospital and you've seen someone come in because they think you have the flu and they come in with a mask, the reason why they're wearing those masks is to stop the droplets, not the air. That is why in the healthcare setting, if someone is confirmed or suspected to have an airborne illness, whether it is tuberculosis, whether it is COVID-19, whether it is open lesions on shingles, we wear what's called an N95 respirator mask that has the little, it's a mask that has the little metal bar on top that you guys have maybe seen, that you can mold that metal bar to cover your nose really good to help get a better seal, so that way you don't breathe it in from your nose, you don't breathe it in from your mouth. So you have to protect your nose, mouth, eyes. All it takes is an AC or a windy day, blow that right into your eyes. That's why this is so contagious. In the healthcare setting, ideally, if someone has an airborne type of infection, they are placed in what's called a negative pressure room. If you're not familiar with what that is, it's basically a room that is designed and engineered to keep the air in that patient's room, so you don't have the air creeping under the doors, if it has a crack under the door, or if you go and open it to walk in. Somehow it is designed to keep that air in so it doesn't spread out. Obviously, in the real world outside of a hospital, that's not always possible. So you do what you can, you try your best to be safe, and as far as disinfecting airborne illnesses, for the surfaces, it's still going to be bleach, bleach, bleach. And wash your hands really good. Really, really good. So during this time, obviously, you do what you can with what you have. Unfortunately, right now, it's a little hard to get some of the things that we need to effectively clean things down. There have been issues being able to get bleach because the hospitals need them. Issues being able to get baby wipes. We're all pretty familiar with the toilet paper fiasco from a couple months ago. I bring this information not to scare anyone. I share this information just to help understand how infections spread, so you can tweak and add in things that you can do to help protect yourself and your family. This is a very scary time right now, I think, for everybody involved. We got this. We'll get through it. I'm sure of it. That said, I also would like to add one more caveat, and that is employers are required by law to provide safe working conditions according to OSHA. That's the whole purpose of the Occupational Safety Health Administration. Maybe one day I will remember that long name, but that is the whole purpose of OSHA. So I'm going to leave a link to OSHA's website in the description below, so you guys can check it out, kind of see what resources they have as far as trying to navigate working if you are not able to work from home and you physically have to get up and go to work. How you can protect yourself from a health perspective, but also, if need be, legally what your rights are as an employee. Always know your rights. Always. I will also leave a link to the CDC's website on COVID-19. The information for COVID-19 is changing all the time, so if any of my information is outdated, I apologize. So I will leave that also in the link in the description box below if you wanted to go and check that out. Alright, that is it for this video. I hope that you were able to find this information helpful, and I want to hear what you guys think. What have you guys been doing to stay safe? I'd like to hear your feedback. If you like this video, or if you have any constructive feedback for me, leave a comment in the comment sections below. If you are interested in nursing, health, or rheumatology content, be sure to subscribe and make sure you hit the little bell if you want to be notified every time I do a new video. I do videos I make weekly videos on one of those 3 topics every Thursday at noon. So if this is something that you're interested in, again, be sure to like, subscribe, and I will see you in the next video. Alright, be safe. This is Ruby. Hi, Ruby. Hi, kitty. Hi, Sweet Girly.